Always good to have your dear viewers join us every Wednesday and Friday. On behalf of Alps Hospital, we love to say a very big thank you to our dear viewers. Thank you for always staying glued to your screen, for always staying glued to our page. We appreciate you all. Today, we're talking about laser vaginal rejuvenation. Yes, that's a big gist I brought for you today. So, feel free to drop your thoughts, your comments, your questions in the comment section. We'll definitely attend to them appropriately. For the sake of someone watching for the first time, we have a special guest with us today. His name is Dr. Kenneth Eguda. Yes, have you heard of Dr. Ken? Yes, he's the Dr. Ken. Oh, yeah. So, for also the sake of someone that does not know Dr. Ken or has not heard about Dr. Ken, it might interest you to know that Dr. Ken is a consultant gynecologist. He's a minimal access surgeon. He's a fertility specialist. He's an IVF specialist and a lot more. Yes, you'll get to know a lot more as we get through this chat today. But for the sake of our time, we'll just go straight to the point. Once again, call up someone, share this link with someone. If you need to send data to someone, please do that right away so they're able to catch a glimpse of what you're about to get this afternoon. So, Dr. Ken,
Yep.
yes, on this platform, I know we've talked about laser vaginal rejuvenation, but we've been having a lot of questions coming up from our social media handles, a lot of concerns. And so we deemed it fit and found it necessary to actually address some of these issues and put a stop to the worries in the minds of a lot of people. And that's what we've gotten you to give us. I'm sure there's always something new to get from you, Dr. Ken. So let's start with what laser vaginal rejuvenation really is for someone that has not heard about it before, what it really entails. Yeah.
Yeah, thank you, Ruth. What you didn't mention, after mentioning all the fertility things and things and things and things, is the fact that you forgot that I'm the pioneer of laser gynecological surgeries in Africa.
My bad.
Yes.
There's just a lot about
And
you,
then
Dr. Ken.
you're talking about laser vagina
Rejuvenation.
rejuvenation.
Oh, yeah.
I think that's the only introduction that makes sense in these days. Next time, get it right.
Please, I apologize. Oh, yeah.
Yes, so laser vaginal rejuvenation means the use of laser to renew or restore the health of the vagina. you know and then there are different kinds of laser. You have the carbon dioxide laser, which is obsolete, has been in use for god knows how long.
Okay.
Then we have the EAT laser,
Okay.
neon laser.
Okay.
But it is diode laser that I'm making reference to.
Okay.
Yeah, diode laser. It's one of the latest technology in laser,
Okay.
in laser energy or laser light, that is used in rejuvenation or in the tightening of vagina.
Wow.
Yes. If you talk about rejuvenation, means something is old or something is out of function or something is not performing optimally,
Yeah.
and then you want to bring back those functions. So laser vaginal rejuvenation means the use of laser lights to restore the health, the function, the aesthetics of the vagina. So that's what laser vaginal rejuvenation it's all about.
Okay.
Yes. So a lot of things happen to a woman from the time she is born
Yeah.
up to the time she gets towards menopause and postmenopausal state. The vagina changes in a lot of ways. But I'd like to
Okay.
take it from the menopausal state
Okay.
to the time of conception.
Okay.
When women get to menopause, for instance, a lot of changes happen in the vagina.
Hmm.
They lose estrogen, their skins, it's flabby, so the tone of the vagina is flabby. I
Hmm.
mean, it's not as tonic as it used to be when they were younger,
Yeah.
you know. And then they would have given birth to. And then women don't understand that vaginal birth, you know, causes trauma to the vagina.
Hmm.
Sometimes this big head of a baby, I don't have a very big head, so there are babies that have very big head. Some of the heads are square like. Mine looks like a pencil. I know that. Some are round,
Hmm.
you
Shapes
know,
of head.
different shapes of head. Some are big, some are average size, and some are quite, some are small. But then the average size is 10 centimeters. You can imagine a 10-centimeter size head
Yeah.
in diameter coming through a 4 centimeters diameter of a birth canal.
Yeah, I
There
can
need to be some
imagine.
expansion. And that
Hmm.
is why it is sometimes when babies are born, mothers sustain traumas. I
Hmm.
mean, tears. Sometimes this the vagina tears down to the rectum, down to the anal
No.
verge, and all of that. And sometimes to prevent that from happening, the midwives or the obstetrician gives a cut, on the vagina to expand the vagina and
Hmm.
makes the damage minimize
Minimal.
minimal, right? So the vagina constantly undergo this trauma,
Hmm.
and then some women give birth to several babies. Then when you are older, there is a loss of tone to the vagina,
Yeah.
so the vagina becomes lax.
Hmm.
The rogae, like the ridges in the vagina that makes the grip during intercourse, becomes flattened out.
Hmm.
So the grip at intercourse, the sensation is also lost to the woman and even to the
To the
man.
man. Hmm.
Then the mucosa of the vagina, which is like the skin of the vagina,
Yeah.
becomes thin,
Hmm.
and gets easily injured during intercourse as a woman is advancing in age,
Wow.
or especially towards menopause and postmenopausal state.
Yeah.
Then you could have some degree of malalignment. I choose to use
Okay.
the word malalignment
Hmm.
of the pipe through which urine comes out.
Okay.
Usually, the angle between the vagina and the body of the uterus, together with the muscles around those outlets, maintain continence for a woman. And so a woman can retain urine for a very long
Long
time. Even when
time.
she's pressed, she's still in control until she finds a comfortable place to empty her bladder.
Blood.
With menopause or with trauma following gynecological surgeries or birth, the alignment can be altered. And so women get to what we call stress urinary incontinence, you know, because of laxity, advancing age, loss of pelvic floor tone, and all of that.
Yeah.
And so a woman gets to a point she wants to laugh, and then you're having a jetting of urine.
Urine.
And so it becomes embarrassing, especially when they're
Hmm.
wearing very colorful clothes like white and all of that. You
Yeah.
know, then the vagina can be dry,
Hmm.
and that can be a problem with intercourse, bruises, cuts, and all of that. So these are all the changes that happen. People don't talk about this easily. You
Hmm.
understand? But
Yeah.
this is the silent cry of many women.
Amen.
I see it as a gynecologist. In fact, even before, during the residency period,
Yeah.
we hear our bosses, the big gynecologists at that point, talking about women coming in requesting for vagina reduction surgeries,
Hmm.
in which case they have to cut the vagina, tighten it and
Yeah.
stitch it,
Wow.
cut off excess folds of the vagina so that the vagina can be
Hmm.
tight again. But
Wow.
then, even with all of that, you can only reduce the caliber. You're not
Hmm.
improving the function.
Function.
So,
Wow.
with laser vagina rejuvenation, now no surgeries is done. Then all these abnormalities could actually be corrected. Urinary incontinence,
Yeah.
painful intercourse,
Yeah.
vaginal dryness,
Hmm.
improving muscle tone,
Yeah.
and post delivery rehabilitation of the
Wow.
vaginal health. So the laser vaginal rejuvenation just does all of this with one approach,
Hmm.
without a cut
Hmm. Wow.
on the woman's vagina or on the woman's body.
Wow.
So wherever you hear about this, it sounds magical, just like the guys in TikTok feel this is too real
Good
to
to
be
be true.
true, but
Hmm.
this is just what it is. So it's just the act of using the laser to renew or tighten or rejuvenate the vagina.
Well,
Long explanation, I guess.
yeah, but that was really insightful. It's a lot of women, at least they'll get to understand how their body works, and
Oh
then
yeah.
they get to see the need why they would actually need some sessions of vaginal rejuvenation. So now you've told us a lot about the woman's body and the things that go on with her, and then where she gets to the point that she needs. So how does laser vaginal rejuvenation actually address these issues, these concerns? Because you're already to our viewers, or to a lot of people that are aware, it feels like, how is this going to be true, or how does this happen? So really, how does it do all this magic?
Oh yeah, yeah. So you see, the laser light has a lot of activating quality or characteristics.
Okay.
Now, during the process of laser vaginal rejuvenation,
Yeah.
you know, a laser probe is used
Okay.
and inserted into the vagina, and the size of the laser probe is just like a dummy penis.
Hmm.
You understand? It's like a tube of
Oh
about
wow.
3 centimeters in diameter, or
Oh
at most
wow.
4. But there are
Okay.
different sizes depending on the width, the width of the vagina.
Vagina.
Okay,
Okay.
you select the one that is befitting
For
for
person that
each
are using.
individual. Okay,
Okay.
so and when the laser is connected, in this case, I'm talking of diode laser, not
Laser.
carbon dioxide laser. You just insert it into the vagina. And then with in and out movements, the laser light is dissipated on all the vaginal surfaces. You understand?
Wow.
And when this is done, the muscles are activated.
Okay.
There is increased formation of new blood vessels.
Oh wow.
Yes, and with the formation of new blood vessels, you have deposition of collagens.
Okay.
Collagens are those stuff that make the skin tough
Okay.
and elastic. They
Okay.
make the muscles, the sub part of the muscle, call it submucosa. They make it tight, and
Firm.
make it firm and elastic.
Wow.
So you have deposition of those materials on the vagina again. Then the reticulin fibers also on the vagina, new blood vessels on the vagina. Then the tone of the muscles is
Restored.
improved.
Wow.
So with the improvement in the tone of the muscles, you have function. And the blood supply. You have even the glands that secretes, that elaborate the secretions
Yeah.
that make intercourse smooth. Gets improving function, and the secretory
Wow.
functions begins to happen all over again.
Wow.
And then when you have some anatomical defects,
Hmm.
like poor angulation of
The urethra.
the urethra, for instance, it gets realigned.
Wow.
And so even the incontinence that these women have can now
Be
be
better.
improved.
Wow.
Then painful intercourse is dealt with because the mucosa, the skin of the vagina, becomes robust, thick, and healthier. And
Wow.
even some cases of chronic vaginal infections
Yeah.
that have been given a lot of medications and all of that have not been taken care of
Care
can
of.
be
Yeah.
improved on, because it helps in restoring the microorganisms that colonize the vagina,
Vagina.
because the vagina
Wow.
is very densely populated with normal microorganisms that
Wow.
protect the vagina and prevent infection. So
Wow.
all of this happens. So when women hear about, or when guys or young folks hear about laser vaginal rejuvenation, what comes to mind is sex. It is not just about sex. Sex is just like
A
one
fraction.
fifth of the benefits
Like
of what laser
does.
vaginal rejuvenation does. A woman is confident when down there looks healthy.
Yeah.
and functional and has some aesthetic looks and all of that. So this is the way the laser does, and then a woman is required to have it, periodically,
Yeah, I was going to
and all
ask.
of that.
Okay, so going to that point, how long does this procedure take? How soon can they see impacts? Because sometimes people want to know how fast should I see results? Or when am I expecting to see the effect of this procedure? So maybe you should give us a little hint about it.
Okay, yeah. So, for first attempt, you require 3 sessions.
Oh wow.
A session per month
Okay.
for 3 months. You understand? A session per month for 3 months, then thereafter yearly. This is
Oh
especially
wow.
for those aging women.
So that means it's possible to even have one session and they might not see results as
Exactly.
because that's not like
Exactly. You
the
need it to be
prescribed.
sustainable because you could have reversal of some of these changes, and so it's just like you just like physiotherapy or like exercise session. You don't do just an exercise and expect every benefit
Everything
of
to
exercise to be achieved.
yes.
So
True.
you go through 3 sessions at least, and if you need more than 3 sessions, the attending physician or
Physician
the laser specialist,
would
be it a nurse or a doctor, should be able to tell you these are the sessions that you need. Sometimes it differ for different persons.
people.
You know, there's
Okay.
an aspect that you could do as many times as possible.
Possible.
There are
Wow.
women that have a VVF, for instance,
Okay.
vaginal fistula.
Okay.
Those women who have difficult vaginal deliveries, and then they have a problem where the mucosa of the bladder is connecting to the mucosa of
Okay.
the vagina.
Wow.
They are connecting, and so she's leaking urine constantly, and then she goes for a repair.
Mm.
you know After repair of those abnormality,
Yes.
VVF repair
Yes.
done by the pelvic surgeons,
Yes.
you will need sessions of this, because the repair is only physical mechanical repair. You need an improvement or reestablishment of function,
Function.
and so you
Wow.
need gadgets or substances that can improve the function. And so that is where laser vaginal rejuvenation is also very important as a means of post-operative rehabilitation after surgery of vesical vaginal fistula
Fistula
repair.
repair. Wow.
So they need these things when they have it, because rehabilitation after VVF repairs can actually be very challenging. So you need both the physiological rehabilitation, mechanical rehabilitation, and
Patient. Wow.
functional rehabilitation.
Rehabilitation.
And
Wow.
then you can even go to a point where you talk about rehabilitation using the PRP
Oh, wow.
injection onto all of those structures so that it will
Okay.
improve on their functions.
Wow.
So this is it. So there is no hard and fast rule. For the postmenopausal women, they need a 3 session, one per month for the first 3 months, then one
Okay.
yearly. You know, yeah. Then for those who are undergoing repair or who underwent repair of a vesical vaginal fistula, for instance,
Yes.
their frequencies should be dictated by their managing physician.
Physician.
Then for those who have delivered, just last 2 years, it was recommended that women should have a session of laser vaginal rejuvenation
Rejuvenation.
after vaginal birth.
Wow.
Yes, because it helps in healing of the muscles that have been traumatized by these heads of the baby and the body of the baby, and by the
Yes.
cord, following the cord, given episiotomy cord,
Yeah.
you know,
Wow.
and they need the vagina to come back to normal again.
Together.
My residency training in gynecology,
Okay.
um, we had at some point that women don't want to have a vagina, but
Wow.
because
Because
they were
of
careful about the health of the vagina. You have some regions of the world where most women come and opt for cesarean section. That's because birth causes to the vagina.
vagina. Wow.
But then in some other part of the world, it's a taboo to have a CS. All because of culture, custom, and all of religion.
Religion. Yeah.
So childbirth, whether cesarean birth
Or
or
vagina.
especially vaginal birth, have takes a toll on the vagina.
Wow.
And then you need a session of laser vaginal care, rejuvenation, or tightening to restore or improve the health of the
Of the
vagina. So
vagina.
it's not just intercourse, it's the health of the
Of the
vagina. And
vagina.
intercourse is just one fraction of the
Of
health of the
it.
vagina.
So, dear viewers, there's just a lot about laser vaginal rejuvenation. As a woman, I know you also want to build your confidence, and part of that confidence is to have a healthy vagina.
No,
Yeah,
sure.
as weird as it sounds, but that's really the truth. A lot
Mhm.
of women have actually, and you see a lot of women silently asking these questions: what could be done?
No,
So yes.
but women actually have been doing it locally.
Mm.
They've been doing it locally
Oh
because
wow.
they visit herbal homes,
Okay.
traditional homes,
Mm.
where they prepare all kinds of
Concussion
yeah, that's
and
the
all.
word, concussion herbs. And then they cook them in
They make them
basins,
to sit
in basins or big bowls, and put some other chemicals in it, like
inside.
potash, and I don't know all the things they put in them,
I've heard of
leaves.
cloves. They say.
All right, all those things. Maybe they even put vanilla in it. I'm not very sure now. Vanilla. What's other spice? There's a popular spice.
Oh, I think it's the cloves I've heard of.
Vanilla. There's this spice people eat everywhere. I forgot what it is.
Hmm.
Oh well, I don't know.
I can't seem to.
Cinnamon.
Okay. Okay.
Cinnamon.
Oh
So they put
wow.
all of that and they make women sit
Hmm.
in them. Yes, it's in an attempt to improve the health of the vagina. And
Vagina.
what women don't tell is this: men are always mischievous. Not all men, by the way.
Hmm.
Men could be quietly mischievous. Once they don't feel comfortable there, they don't even talk to you. They go do
Hmm.
what makes them comfortable. So the pressure is on the woman to make herself fit for her partner.
Yeah.
So they go to all these herbal homes and they make them sit in
And
hot
all
water.
that.
We've seen a good number of them with bonds around the pelvic and the
Hmm.
private parts. Then some
Hmm.
of them come with adhesions in the vagina,
Oh
and
my
you have to
goodness.
operate it,
So
somehow to get it
wow.
fixed again.
Wow.
So those are all the things that women do. But
Hmm.
laser is healthy because there is no cut.
Hmm. Yeah, I was going to ask. Maybe you tell us how this procedure is, because some people might still be thinking it's a very long procedure. What's the duration of the procedure? How fast? Is this something that they could just come and then boom, they are done?
Oh yeah, it's so interesting the way it's not a surgical procedure.
Oh, okay.
It just not there's no surgery in it.
Hmm.
Previously, if we want to do it, we go to the operating room and just cut the skin of the vagina, the mucosa of the vagina, and
Yeah.
reattach, cut off the excess and reattach what you have left to make it
Yeah.
tight.
Hmm.
And then this procedure can take 2 to 3 hours.
Wow.
You understand? And then the woman is under anesthesia.
Hmm.
And then when she heals, she's left with scars in the vagina.
Wow.
And then the scars can make intercourse even painful. You will achieve the grip, but intercourse will become painful.
Painful.
Then
Hmm.
you could use lubricants to to minimize the pain, but it's still not very functional.
Comfortable. Hmm.
Anesthesia, then you don't return to your to sexual life till about 2 months later or 3 months
Wow.
later. That is if
When
you
you're
heal
healing,
perfectly.
exactly.
But with laser, it's just the tube you insert into the vagina and it showers the light on the vagina wall.
Wow.
It's going to sound so false for me to say there are no complications, but the truth is that there are no
Oh
complications.
wow.
I've seen on my TikTok page, for instance, guys asking, ladies asking, say it's impossible for there not to be, but there are no complications
Hmm.
because the warmth is about 45 degrees.
Oh wow.
This is like the temperature of the tea you
You
drink.
drink. Hmm.
So see if it doesn't burn your throat or burn your tongue or your mouth,
Yeah.
it's not likely going to do anything. So the worst you feel is just some discomfort of heat, warmth. That's all. That's all
Hmm.
you feel.
Wow.
And then you recover from that within the next 2 to 3 days. And then in 4 days' time, you're back to sexual life again.
Wow. Hmm.
So we hardly even give a paracetamol.
Hmm.
After that, you can just give the regular vitamin C and some of those supplements that help um,
It's regeneration.
muscles and mucosa to rejuvenate,
Regenerate.
to regenerate, and all that. The zinc,
Yeah.
and then the estrogen.
Oh wow.
For those who require estrogen. So there are no complications except warmth,
Wow.
no bleeding
Hmm.
at all. You
Wow.
understand? Then Somebody just asks on the TikTok page whether it causes cancer.
Hmm.
You know, it doesn't cause anything.
Wow.
It doesn't cause cancer.
Wow.
You know,
Hmm.
so the only complication we can talk about is the warmth, if at all it's a complication. It's
Yeah.
just the warmth.
Hmm.
Women have a lot of things bothering them that cause cancer. The
Hmm.
talc powder they put in the vagina can cause cancer. The
Cancer.
human papillomavirus can cause cancer.
Hmm.
Cancer of the cervix, for instance. The endometrial, the polycystic ovary with a lot of estrogen without control, without break, can cause endometrial cancer. Then the
Wow.
breast cancer and all of that. Laser doesn't cause cancer. It doesn't. People are
So
just scared of what they don't even understand.
wow.
It doesn't cause cancer because I remember seeing up to 7 people asking,
Oh
does it
wow.
cause cancer? Does it cause the
Cancer.
diode laser doesn't cause cancer? For instance, uh, when I made the first paper presentation
Hmm.
of laser gynecological procedure in Nigeria,
Yeah.
you know, and then we had over 947 laser hysteroscopic surgeries.
Wow.
Yeah,
Hmm.
without
That's a lot.
recording any significant and this is actually surgeries where you cut people with laser.
Hmm.
But vaginal rejuvenation is not surgery. No complications of such. So it should allay their fears. There are no complications.
So
The
dear viewers.
complication is just the costs.
Oh yeah. Well, nothing good comes
Oh,
so easy
sure,
and so
nothing good
cheap.
comes easily.
Oh yeah. So dear viewers, there's just a lot about laser vagina. As a matter of fact, I saw something online, and the person was saying that people could actually just take their break. I think he said you could just take a tea break and you
Oh,
could you
sure.
could just come for. And
Yeah.
I'm like, is
You know,
this so short a procedure that you
mhm.
could just use
if,
your
if
break
if
time?
if if you have an appointment, for instance, with
Yeah.
your doctor,
Mm.
wherever it's done, there are not so many places where it's done. Alps Hospital is one of those places. It's just about 10 to 15 minutes procedures.
Wow.
So you could just take your lunch break
Yeah.
from your workplace and
Mm.
just, if you're sure of your appointment time, you walk in, get ready before you come, and you do it and get back to
To
work
work. Wow.
and finish and get back home. So
Wow.
that's how true it sounds.
It's
It's
really too
about 10
good
to
to be
15
true.
minutes procedures. So
Wow.
if for sure you're coming, you get
Hmm.
everything ready. So you just
Ready.
come straight, you walk in, and you
Wow.
have it done, and you're
Wow.
gone.
Hmm.
So it's a short procedure. That's per session. It's 10 to 15 minutes.
Wow. So
Yeah.
you see, dear viewers, there's really nothing to be scared of. There's
Mhm.
nothing to be worried. And yeah, for someone that probably has had a session and you feel you're not seeing the impact, we've heard it from Dr. Ken today.
Mm.
And you could also, I'm sure you could also, you've been doing some readings too for some people that are
Mhm.
watching. One session might not just be enough, or it's not even enough for most people. So it's good that you adhere to counsel given to you by your physician, managing physician, so you're able to get the best results. And don't
Mhm.
be hoping so much when you are not actually doing the right thing, and then you're hoping to get ample results. Everything should just happen as once when you're not doing it the right way.
Mhm.
3 sessions consecutively, and then yearly basis. And then yes, don't be also surprised when your physician tells you, I think you need more than 3 sessions. That's why he said it's based on the assessment of your physician. So keep an open mind and do not have any fears with regards to any complications about laser vaginal
By the way,
rejuvenation.
everything in life has complication, but laser seems not to have. Yeah, people ask about complications. For instance, if I distract you a bit, you
Mm.
go to women, you are trying to get women access epidural, and the first thing they talk about is some complication. By the way, you're a woman. Why is it so frequent that the most uppermost thing in the woman's mind is complication? Epidural, pain relief in labor,
you,
they talk about
you
complications.
know, so
Surgeries, cesarean section, women talk about complications.
so you know what? I think a woman is wired to always
To
think
always
of
be
what
afraid.
if. What if? Most times they will say, men, you don't think of the risk. You're just one-way traffic. Let's just go get it. And
Yeah,
then
that's how we achieve results.
but the woman is always like, what if? What if? I
What
mean,
if not?
it's just like Lot's wife in the Bible. She was,
I think
One way.
they should behave like Lot's wife. Don't look back, they look back. So don't be scared to look back.
So we're always worried about what if. We're always thinking of the after. So I just feel that's how women are wired. And somehow you have a few
They
men
should
that
rewire their mind. But not every woman anyway. I've seen very bold women, more bolder than men, and I admire them a lot. So not every woman. So I think we should. Everything has complication. If you play football, there's complication. If you drive a car, it's complication. If you fly a plane, it's complication. If you eat food, there's complication. So they should think less of complication and just explore. Just explore the world. That's just all I can say at this point. Yeah,
be adventurous.
that's the word. Be
Oh
adventurous.
yes.
Yeah.
So do you think there are people that do you think there's a contraindication to vaginal rejuvenation, or do you think everybody can have laser vaginal rejuvenation, or there are particular people that you feel okay, if you are like this, we don't think you would benefit from a laser vaginal
I've never
rejuvenation?
thought of this, but I know that there are different indications for laser
Okay.
vaginal rejuvenation. If you have any of those problems we mentioned, stress urinary incontinence, when you laugh or you cough and you have a leak of urine,
Yeah.
you need before now you need a surgery to correct that. We call it the bulking surgery.
Okay.
To correct that. But now
Yeah.
laser vaginal rejuvenation can fix that. If you have painful intercourse and easy bruising at intercourse, where the cause is not clear,
Yeah.
you need laser vaginal rejuvenation. If you have a laxity of your vaginal wall and the vaginal is wider than it used to be, following complaint from someone or from your own observation, you need laser vaginal rejuvenation. If you have some degree of prolapse, now I don't know who is listening, but prolapse means an outpocketing of either the bladder because of the weakness of the pelvic floor. The bladder can push itself into the vaginal wall, and you could feel part of the bladder in the vaginal wall, or even the rectum from posterior pushes itself into the vaginal wall. We call this cystocele and rectocele. So the lower grades of cystocele and rectocele can be fixed without
Benefits.
surgery
Wow.
using the laser vaginal rejuvenation. If you are a woman and you've given birth before and a big baby, comes out of the birth canal,
Yeah.
definitely you have some injuries. It may not be so big to be noticed, but of course, that place has been stretched to a breaking point.
Yeah.
You need laser vaginal rejuvenation. But if you don't have any of those things, you don't need it. That's all I can say. But at some point, every woman who is alive will get old.
Yeah.
And so estrogen level is going to get lower, and then all the postmenopausal problems that has to
Begin to
do with
step in.
urination,
I know.
vaginal health, infection, prolapse for those who have multiple births, eventually it's
You
going to
still need.
be necessary. And I mentioned earlier, it's been recommended that following vaginal delivery, women should have at least a session of laser vaginal
Vaginal
rejuvenation. It
rejuvenation.
doesn't hurt anybody. You know, it's difficult to see anybody who has not taken an injection.
That's
Yes,
true.
needle injection,
Yeah.
either for some one reason or the
Or
other.
the other.
Okay, that injection is 20 times more uncomfortable than
Yeah.
laser vaginal
Wow.
rejuvenation.
Oh, that's
I can't
that's a
count the
very
no,
easy.
I can't count the number of injections I've had in my lifetime. I used to be a very sick boy.
Oh wow.
And thanks to my mom who took good care of me, always taking me to the hospital. Several injections.
Wow.
Even to this
Imagine.
age, we still take injections when we're ill. Laser vaginal rejuvenation is nowhere close to the pain that
The
a needle
injection.
prick gives to you.
Wow. So you
Yeah,
see, that's more like it's painless because every needle prick is painful.
it's very painful.
Oh yeah. So dear viewers, there's just a lot about laser vaginal rejuvenation, and we've heard a lot. I'm sure you can't even get this from even a professional class, and Dr. Ken has just pieces this like on one sitting. So there's just a lot that I know you guys have
Even in
heard.
medical institutions, by the way, you don't find this kind of talks, because in the world on its own, you only have few places where you have institutions of laser. One of those places is Bulgaria, one of the institutions where I trained in the world,
Okay.
and another is Barcelona, Hospital del Mar in
Hmm.
Barcelona. Then you have it in Israel. You
Oh
have
wow.
we're working with a group in India
Okay.
where we not do just laser gynae procedure, but microwave gynecological procedure,
Procedure.
all
Wow.
to avoid
Hmm.
cuts. So
Hmm.
these are a few places in the world where you find this. You
Yeah.
understand? So it's not even an institutionalized things for training, but some of us are product of the International School of Laser Gynecology, in addition to other things. So uh, I think with time it becomes popular, but this is where the
It
level of
is.
the informations are limited to
Wow.
for this at this point in time.
So we're privileged to have one of the world's best laser specialists with us today. Are we not just lucky, dear viewers? Thank you once again, dear viewers. Dear viewers, I see all of you that have joined, our regular followers, those of you online. Thank you all for joining. I can see you, Dixie. I can see you, Justina. I can see you, just that we cannot keep mentioning all the names, but we really appreciate you guys for joining. It was really amazing and good to have you all engage us today on our platform this afternoon. Thank you once again. Dr. Ken, it was good to have you. Do you have any counsel to give to people
No, to
with regards?
doctors. My
Okay.
counsel is for medical practitioners.
Mm,
Before I went into laser,
okay.
I was used to the use of diatomy,
Okay.
monopolar, all energies in surgeries,
Okay.
all the ways they operate.
Yeah.
But once I started using laser, it became very addictive.
Hmm.
So, and very easy to apply. It makes surgery a lot easier. I'm not
Easier.
talking of rejuvenation now. It
Yeah.
makes surgery a lot easier. And much more importantly, laser is the most refined form of energy
Hmm.
to be used on the human body,
Wow.
because it doesn't only preserve the human body, you
Yeah.
know, it activates some dormant parts of the human body. For
Wow.
instance, the laser light,
Hmm.
activates dormant eggs and improves
Hmm.
a woman's chance in getting pregnant.
Wow.
Yes. Electrical energy, for instance, if it's used on the ovaries, in as much as you are doing good, it still damages some part of the
Surrounding.
ovaries
Wow.
and reduce the ovarian reserve.
Hmm.
But laser doesn't do this.
Wow.
So it is the most refined form of energy.
Hmm.
So when you talk about complication, it is least compared to all other energies to be used in surgeries.
Hmm.
And so
You are going to consult
my
the
advice
doctors.
is for doctors
Yeah.
to get to use it. We've seen a lot of doctors coming to be trained, and we've trained quite a number of them. We're not stopping yet until women are given the best
Best.
form of care.
Hmm. So yes, this is coming from a very, very concerned fertility specialist and a very, very good one at that. Thank you once again, Dr. Ken. It was really good to have
Are
you
you
with
paying me
us.
for this?
We discuss. Oh, dear viewers, once again, it was good to have you all join us this afternoon. Please, if you have your questions, keep dropping them. We will definitely attend to them. There's a number being displayed at the screen. You could forward and have a lovely day.